Hello, I'm Dr. Steve Levitt. I'm a physician and president of Pain Resource Center. And if you are a clinician interested in finding out about our TMJ and chronic pain online testing services, I invite you to go to that part of the website where you can read more about it. If you haven't yet signed up and registered to obtain your free test so you can try out our services with no further obligation, I invite you to do that online, or you can call our toll-free number. I'd like to make some remarks now directed to people that are having TMJ problems and symptoms. Temporomandibular joint disorders, or TMJ, refers to a group of disorders affecting the jaw joint and the surrounding muscles and tissues, soft tissues. The National Institutes of Health statistics, along with other surveys, indicate that between 5 and 15% of the American population have these symptoms. Many have these diagnosed or undiagnosed disorders. This disorder or this group of disorders is difficult to diagnose. They often imitate or mimic other problems. They have been called the great imitator. Other problems are present at the same time can confuse the diagnosis. Clinicians that are not well trained in this area may not be highly alert to recognize TMJ and may not be make the appropriate referrals for further evaluation. Now, what are the symptoms of TMJ? Well, pain is one of the main ones. Pain in the area of your jaw joint, in your ear, headaches and neck aches. Also, your jaw may feel stiff. It may not work smoothly. Your jaw may lock open or closed. Your jaw may make sounds like clicking or popping or kind of grinding noises when you open and close your mouth. You may not be able to open your mouth as wide as you used to, and your bite might feel off or like it's changing. Your teeth might not feel like they fit properly together. All of these are possible symptoms of a temporomandibular joint disorder. The question, of course, is, do you have it? Now, guessing about this is not a very good idea. Filling out questionnaires from time to time that I see that have absolutely no scientific basis and no known accuracy is also not a very good idea. Reading about it and learning as much as you can is a good idea, but that still does not give you a tool, a method to make an accurate prediction. We thought, there are so many undiagnosed people who have this problem. Wouldn't it be a really good idea to provide sort of a self-screening test for an individual who would like to find more out about their problem? And so what we decided to do is take the exact same test that the doctors use with the same accuracy and the same reliability and create a simple one-page report which in plain English lets you know whether or not you have a TMJ problem. That is, what the probability is that you have this problem. It also discusses whether your muscles and jaw joint are involved. It discusses your pain level. And in addition to that, even if you have TMJ, even if you know you have it and you've been diagnosed with it, wouldn't you like to know what the severity of your problem is compared to other people? And wouldn't you like to know what your pain level is compared to other people? And on top of that, people with TMJ have elevated levels of stress and emotional distress. Wouldn't you like to know if your levels are elevated and how they compare to others? This test will tell you all of that, in addition to whether there is a possible another disorder that's complicating things present at the same time in that area of your head and neck. And finally, wouldn't you like to know what the probability is that your disorder may become or already is a chronic problem? The TMJ scale report will tell you all of that information. Now, the American Academy of Craniofacial Pain, the AACP, is a leading organization of TMJ specialists in the United States and with an international membership, and they discuss the TMJ scale on their website. They describe the test as accurate, as quick and inexpensive, and they suggest its use as a self-screening tool for individuals who are concerned about their symptoms and who would like to learn more and maybe get a better idea as to whether or not they need some professional evaluation and help. You can read the comments, testimonials by TMJ specialists, by very well-known and respected TMJ specialists on this website. And at this point, thousands of individuals have also self-screened themselves successfully with the TMJ scale. So how does it work? Well, if you decide to take the TMJ scale test, you can do so on this website. This is the only place that test is available for individuals. The test really only takes 15 to 20 minutes. You will not be asked any confidential information. The report will not contain your name, your address, your telephone number, your social security number. None of that information is required. The only mandatory question is whether you're male or female, because the test is scored differently for men and women. You will be presented with 97 symptoms, and you will simply, with the click of your mouse, indicate how much of the time you have each of those symptoms. And then, when you're finished with the click of the mouse, your report will be instantly generated for you, and you will be able to save it, print it, and use the information. But the TMJ scale has the highest scientifically documented and repeatedly studied accuracy of between 88 and 93% in predicting the presence of a temporomandibular disorder based on a patient's symptoms, and without any outside influence by a clinician and any outside bias. So you can read more about TMJ and the TMJ scale on this website. I invite you to look at the up to probably 40 different publications in the scientific literature and the clinical journals about the TMJ scale. I invite you to read about the case studies of individuals who have been helped by taking this test, and then you can decide if you think this would be a good idea for you. And regardless of whether or not you take the test, I wish you good health in the future. Thank you for your time.